There are 80,000 people just in Connecticut living with Alzheimer's disease and another 178,000 caregivers. So a lot of people have had a lot of challenges during this pandemic, and we've talked about that. But let's forward the conversation now to the future. What is on the horizon in terms of research? Well, the Alzheimer's Association Connecticut chapter is hosting a virtual research presentation this coming Tuesday. And joining me right now, I'm happy to have Dr. Carl Hill. He's the Vice President of Scientific Engagement for the Alzheimer's Association. Doctor, thank you so much, and let's get right to it. What is on the horizon with research here during this COVID-19 pandemic?
I tell you, Tim, thanks for having me here today. Most Alzheimer's research, as is most research that involves face-to-face human interaction, is paused at this time. That goes for our exciting U.S. pointer study, which is testing a lifestyle-based treatment to prevent cognitive decline. So this is concerning, because we desperately need more knowledge about the causes of Alzheimer's and all other dementia. But there are resourceful researchers that are finding new ways to conduct their science remotely using remote monitoring or advanced technology or telemedicine techniques, for example. So we know that the momentum is continuing, and the Alzheimer's Association is holding regular teleconferences and webinars to keep our thousands of researchers engaged. And these are the leading scientists in Alzheimer's research all over the world, so that we can continue to discover and keep learning more and more about the causes of Alzheimer's. So we are encouraging the conversation between scientists and working with them as they envision and plan to restart their research and their work.
And I would love to find out more about those lifestyle interventions once that study is done, because that could be a game changer, certainly. And I'll ask you about that if we have time. But I do know on Tuesday, I guess you're going to talk some about health disparities amongst diverse communities. What is that exactly all about?
Well, Tim, we know that African Americans and Latinos and women are disproportionately affected, are more likely to develop Alzheimer's and other dementias. African Americans are twice as likely, and Latinos 1.5 times more likely to develop Alzheimer's and other dementia. So it's crucial that we understand the many factors that might be involved here. And when Tim, as you mentioned, lifestyle, there's an important research with our U.S. pointer trial that's given us more information about how individuals from these populations can engage in a healthy lifestyle, and the barriers for these populations engaging in that lifestyle. So this is very important, and to understand this, we've got to be sure that we recruit and retain African Americans and Latinos into Alzheimer's research. So we know that using participatory models, really engaging communities and tailoring research to the needs of these communities is so important. There are a few projects there, even in Connecticut, which uses this participatory model. So I'm really looking forward to discussing some best practices and lessons learned as it pertains to Alzheimer's research and disparities in these disproportionately affected populations, Tim.
Wonderful. And you know what, Doctor, we are out of time, but hopefully that study can get back up and running, get it off of pause soon. And we would love to talk to you more about once it's gone through its rigors and what other possible connections you could find. That's always a big problem with these things. Is it nature? Is it nurture? To what degree is it genetic? To what degree is it lifestyle stuff we can control? And hopefully it's a lot of the latter and less of the former. So Dr. Hill, thank you so much for your time.